Welcome to our channel Physio Quick Learning. Let's have a quick revision on joint range of motion of upper limb along with the muscles which carry out the movement. First we'll see about the shoulder joint. The movements that take place at shoulder joint are flexion, extension, abduction, adduction, medial and lateral rotation. For shoulder flexion, primary muscles used are pectoralis major and anterior fibers of deltoid. The secondary muscles used are coracobrachialis and short head of biceps brachii. Range of motion for shoulder flexion is 0 to 180 degree. Now we'll see about shoulder extension. The primary muscles that causes shoulder extension are posterior fibers of deltoid and latissimus dorsi. The accessory muscles are long head of triceps and teres major. Range of motion of shoulder extension is 0 to 60 degree. Now we'll see shoulder abduction. The primary muscle that causes shoulder abduction is supraspinatus and deltoid. These muscles produce abduction from 0 to 90 degree. From 90 to 180 degree, the muscles involved are serratus anterior and upper and lower fibers of trapezius. For shoulder adduction, the primary muscles are pectoralis major, latissimus dorsi and short head of biceps brachii. The range of motion for shoulder abduction is 180 to 0 degree. For medial rotation, the muscles involved are pectoralis major and anterior fibers of deltoid. The range of motion of medial rotation is 0 to 90 degree. Now, lateral rotation. The primary muscles are posterior fibers of deltoid, infraspinatus and teres minor. The range for lateral rotation is 0 to 90 degrees. Now we'll see elbow joint. The movements occurring at elbow joint are flexion, extension, pronation and supination. For elbow flexion, the muscles used are biceps brachii, brachioradialis and brachialis and the range of motion is 0 to 140 degree. For extension, the muscles used are triceps and anconeus and the range is 140 to 0 degrees. For supination, the muscles used are supinator and biceps brachii and the range is 0 to 90 degrees. For pronation, the muscles used are pronator quadratus and pronator teres and the range is 0 to 80 degrees. Now we'll proceed to wrist joint. The movements occurring at wrist joint are flexion, extension, radial and ulnar deviation. First we'll see flexion. The muscles involved are flexa carpi radialis, flexa carpi ulnaris and palmaris longus. The normal range of flexion is 0 to 80. Now we'll see extension. The muscles involved are extensa carpi radialis longus and brevis and extensa carpi ulnaris. The normal range is 0 to 90 degrees. Now we'll see ulnar deviation. The muscles involved are flexa carpi ulnaris and extensa carpi ulnaris. The normal range is 0 to 45 degrees. Now we'll see radial deviation. The muscles involved are flexa carpi radialis, extensa carpi radialis longus and brevis. The normal range is 0 to 15 degrees. Hope you like our video. Please like, share and subscribe. So let's learn together, grow together.